I am Mike Dowling. I am the President and CEO of Northwell Health, and it gives me great pleasure to welcome you to this Raise Health Forum. Let me begin by thanking all of the moderators and all of the speakers. I thank you for your participation today. And I also want to say a special thanks to the staff who actually made all of this happen and did the hard work to make sure that this will go smoothly. You know, for those of us involved in healthcare, those of us involved directly, but also those even seriously interested in healthcare, we have a special obligation and a special responsibility, especially now as we slowly emerge from the COVID pandemic. We have a responsibility to share information, to share best practices, to learn from one another, to teach one another, to inspire each other, to look for solutions, not excuses, to challenge, intelligently challenge the status quo, and to broaden and expand our definition of health. So for the next period of time, we're going to discuss a number of very important issues, important to the future of health in this country and beyond, all of which are quite interrelated. We're going to be discussing the social determinants of health, difficult, complex issue. But without addressing those, we are not going to make the necessary improvement in health that we all aspire for. We're going to be discussing issues of access and equity, so evident during COVID, the problems associated with equity, so evident during COVID. Certain populations disproportionately affected. So the question, of course, is, what do we now do collectively going forward to improve that circumstance? We're going to be discussing issues around women's health, which has often in the past been relegated to the back seat of discussion and misunderstood. So we will clarify that issue, talk about what needs to be done. And we will also discuss issues of environmental health, the air we breathe, the water we drink, the food we eat, the circumstance that people live in, what our responsibility is, along with so many others. And we're going to be talking about technology, technological innovation, what that means for the future. They all seem a little separate, but they are all interconnected. One feeds into the other. So for the next period of time, let's relax, enjoy, learn, and hopefully leave with some ideas about how we can go back to our respective facilities and locations and improve what we do. And of course, the other benefit of a program like this is to build a network of relationships, to stay in contact, because what happens in one place affects what could potentially happen in another. So again, I thank you so much for participating and being with us today. And I just close with a quote that I like from Ralph Emerson. He said, "Don't be constrained by your problems. Be led by your dreams." So again, thank you. And it is now my distinct pleasure to introduce Dr. David Battinelli. He is the Chief Medical Officer of the Northwell Health System. So I'll turn it over to David. All yours, David. Thank you.